Welcome to the latest edition of Immunology Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. AstraZeneca reports that the FDA issued a complete response letter for subcutaneous Saphnelo for adult systemic lupus erythematosus. The BLA was supported by an interim analysis of the Phase 3 TULIP-SC study, and a subsequent full analysis confirmed the primary endpoint. AstraZeneca has provided the requested information and is targeting a decision in H1 2026. Intravenous Saphnelo remains available. The EU CHMP issued a positive opinion for Imfinzi combined with FLOT as a perioperative regimen in resectable early or locally advanced gastric or gastroesophageal junction cancer. The Phase 3 Matterhorn trial demonstrated an event-free survival hazard ratio of 0.71 and an overall survival hazard ratio of 0.78, with safety consistent with known profiles. The CHMP also delivered a positive opinion for Rezurock, recommending conditional marketing authorization for adults and adolescents aged 12 years and older with late-line chronic graft-versus-host disease. The decision followed re-examination and drew on multiple studies and real-world evidence, with a confirmatory randomized controlled trial planned. Biogen's Litifilimab, also known as BIIB059, received FDA Breakthrough Therapy designation for cutaneous lupus erythematosus. The designation reflects the totality of evidence, including the Phase 2 LILAC study that reduced skin disease activity versus placebo, and recognizes Litifilimab as a first-in-class BDC, a targeting monoclonal antibody. The FDA accepted Galderma's BLA resubmission for relabotulinumtoxinA, a ready-to-use liquid neuromodulator for glabellar and lateral canthal lines. The resubmission is supported by the READY Phase 3 program with more than 1,900 participants, which reported rapid onset and effects lasting up to 6 months. Sanofi's Rilzabrutinib received FDA Breakthrough Therapy designation for warm autoimmune hemolytic anemia and orphan designation in Japan. The designations are based on the ongoing Lumina-2 Phase 2b study, and the Lumina-3 Phase 3 study is underway versus placebo. China's NMPA approved Valsipity, etrasimod, for adults with moderately to severely active ulcerative colitis who had an inadequate response to conventional or biologic therapy. The approval was supported by ENLIGHT-UC in Asia and the global ELEVATE-UC12 and ELEVATE-UC52 studies, and confirmed a safety profile consistent with prior research. Etrasimod is a once-daily selective S1P receptor modulator. Priovant reported positive Phase 2 BEACON results for Brepocitinib in cutaneous sarcoidosis. In this 16-week randomized, placebo-controlled trial across 15 U.S. sites, the 45 mg dose improved the cutaneous sarcoidosis activity and morphology instrument activity score versus placebo, aligned with patient-reported outcomes, and showed favorable tolerability. A Phase 3 program is planned. Stay ahead in immunology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare